Alright, today we are going to talk about the mnemonics to instrumental delivery criteria. So, when we do instrumental delivery, there should be criteria to be fulfilled. So, let's see today what is this criteria. And today I'm going to introduce you a new mnemonic to remember this criteria. The mnemonic is forceps. Let's see what are the terms regarding this forceps. Okay. First term, let's see. F stands for a fully dilated cervix must be there to apply any instrument in the delivery. And the O stands for obstructions. In here, all the obstructions should be excluded prior to insertion of any instrument, such as any capillopelvic disproportion should be excluded. The R stands for a ruptured membrane. So the membrane should be ruptured prior to applying this instrument, such as ARM should be, or ARM can be done to rupture the membrane, or automatically spontaneously the membranes may be ruptured. And the next one is review the procedure. So we should continuously review the procedure, whether the baby is descending or not, whether the instruments are working or not. We should be checked it. The C stands for the consent. I included it here, but the consent should be taken at the very beginning before applying the instrument. Next one is the catheterized bladder. The bladder should be catheterized prior applying the instruments. The next one is check instruments prior to applications. So in here, before applying these instruments such as kiwi cup, any forceps or any ventos, we should check whether these instruments are working or not, because if it is not working on the way of this procedure, we have no time, and it may gives us many problems. So prior to applying this instrument, we should check whether these are working or not. E, let's see what is E. Explain the procedure to the patient. So if the normal vaginal delivery fails or it get delays, we are trying to go for any instrumental delivery. So here we should inform the patient and explain the procedure, what is and what are the things that we are going to do in here, and it is very important. It will calm the patient and it will ease our procedure also. The next one is the epidural analgesia. Epidural analgesia is a very good analgesia method, and if it is available, we must try and we should give epidural analgesia. If not, in some countries we are practicing pethidine or Entonox like analgesia, but epidural is the best. Next one is the examine genital tract to exclude trauma. When we apply instruments, many traumas can occur to the genital tract, so we have to examine any trauma, and we have to either suture or pack with gauze after the delivery. P stand presentation. The presentation should be checked, because the presentation can be capillary or breech. We should apply this mainly. The instrument and deliveries are carried for capillary presentation, so we have to check the presentation prior to the applying. And the next one is because the type of the instrument changes with the presentation of the fetus. So next one is the position of the head, whether it is occipital anterior, occipital posterior. We have to check it prior to the applying. Next one is the power. Power means the uterine contraction. The adequate uterine contraction should be there. If not, the baby will not descend very easily. So we have to adjust the oxytocin dose adequately to give the adequate uterine contraction. So it will increase the power and expel the baby. Next one is the placement of forceps blades or the ventos cup correctly. In here we should exclude maternal tissues, and correctly we should insert this instrument to the fetus head or other. If the breech presentation, we should apply correctly without the maternal tissues. The next one is S stands for station of the presenting part. In here, the presenting part should not be above the ischial spine, and we should check it prior to the applying. The next one is the senior's help. If needed, if this get prolonged, so we have to inform our seniors and get their help. And here you can see a kiwi cup, and here you can see a forceps. So in our next video we will bring you about more details on this forceps. And that's all for today. And okay, thank you.